In this Get Pregnant Now Quickie episode, we're talking about how you can be on the path to insulin resistance even when your labs say everything looks normal, and how this directly impacts ovulation and fertility. Welcome to the Finally Get Pregnant Naturally podcast, the podcast helping women identify the real reasons you haven't conceived or stayed pregnant so you and your partner can finally grow the family of your dreams. I'm your host, Dr. Katie Wood. Let's dive in, shall we? In today's episode, you'll learn why quote unquote normal, even optimal A1C and fasting glucose don't always mean healthy blood sugar regulation, how insulin resistance disrupts ovulation and hormone balance, and early signs your body may be struggling with blood sugar before a diagnosis will ever happen, especially in the doctor's office. So this episode is really going to talk about why blood sugar matters for female fertility. And I just want to kind of remind you that blood sugar doesn't necessarily mean or equate to a diabetes diagnosis. It is very much a fertility issue because insulin, your blood sugar hormone, directly impacts ovulation, testosterone levels, your egg quality, inflammation in the body, and hormone signaling. So I think a lot of times people may separate like diabetes from fertility, but actually they can be interconnected and you don't have to be in full-blown diabetes or even like pre-diabetic to have insulin wreaking havoc on your fertility. So when insulin is elevated, even slightly, it can suppress your ovulation. It can increase androgens, aka testosterone production, and it can disrupt follicle development, which is literally one of the most important pieces of your menstrual cycle. Follicular development is going to lay the foundation down for the remainder of your cycle, including your progesterone levels. This is actually one of the biggest drivers behind conditions like PCOS, but it can also affect women without that diagnosis. So you don't need to have PCOS to have insulin resistance or the early stages of it. And like I said, normal labs don't tell the full story. And this is where people can get in trouble or find themselves in a predicament of struggling to conceive for so long because their doctor is only ordering these very basic surface level labs and they're being told everything looks normal, so they don't understand why they're not getting pregnant, but it's because we're not taking a deeper look. So that's really where I step in and help people actually figure out what the heck is going on. And like I had said, you can have a normal A1C, a normal fasting glucose, but you can still be in the early stages of insulin resistance. And I have seen this firsthand in my clients' labs. Why? Why can this happen? Because your body is incredibly adaptive. And sometimes it does take time for symptoms that your body is communicating with you. But for a lot of us, it takes for our body to be screaming at us for us to finally figure out that something is going on underneath. So your body is very adaptive. And in the early stages, your pancreas is just going to keep producing more insulin to keep blood sugar in a normal range. So that's why it looks normal on paper, normal on your labs. So your labs could say your glucose looks fine, your A1C looks fine, but in reality, your insulin is elevated. Your cells are becoming less responsive, and your body is having to work harder to maintain that balance. And that elevated insulin is what is going to disrupt your ovulation. So, what the majority of doctors are not testing is your conventional labs are likely not including fasting insulin, which means you're missing a piece of the puzzle because insulin resistance starts years before blood sugar levels would show as abnormal on labs. And this is something that I walk each and every one of my clients through inside my Fertile as a Mother one-on-one program. We're looking at more comprehensive and deeper markers and patterns, not just surface level labs. And I do want to say this is not just a female issue. I've had very recently a few male clients with fasting glucose and A1C within normal, even optimal fertility ranges. But then when I look at their fasting insulin, it is significantly out of range and elevated. And they're in the early stages of insulin resistance. And this can be extremely disruptive to sperm quality and the DNA integrity of that sperm. And not only can that have an impact on your chances of conceiving, but that can also increase your risk of miscarriage. Like I said, by the time glucose is showing up as abnormal on labs, the body has often been compensating for a long time now. So, what are some early stages of insulin resistance that you or your partner could possibly be experiencing? So, even without labs that are off, your body could be giving you, right, some information, some cues, but oftentimes we're dismissing it as, oh, this is just my normal, or we're just so busy that we don't even notice. So, experiencing any energy crashes after meals, having intense sugar or carb cravings, having difficulty losing weight or unexplained weight gain, definitely having irregular cycles or anovulation, waking up between the hours of 2 and 4 a.m., experiencing brain fog or fatigue. Potentially, your partner has a poor semen analysis. There could be some things off on there. And these are just early warning signs. They're not random symptoms that you have to live with or that's even normal because your mom and your dad and your aunt have had the same issues. No, these are warning signs from your body, and they are definitely things that you are not a victim to because of genetics. There are things that you can do about this and take intentional action. So, how does this block ovulation? Because that's like the most important key in terms of getting pregnant is you need to ovulate and you want to have a healthy ovulation. When insulin is elevated, the ovaries are stimulated to actually produce more testosterone. So that's where that elevated testosterone piece comes in with PCOS. Your follicles are going to struggle to mature properly, and ovulation becomes delayed, or it doesn't happen at all, or if it does happen, it's very weak and suboptimal. And even subtle imbalances can shift your body out of an optimal fertile state. And this is why focusing only on getting your ovulation timing correct misses the bigger picture because the issue could actually be more metabolic. Okay. So, what can you focus on? Supporting blood sugar, honestly, doesn't really have to be that extreme or that hard. I feel like once you know the basics and it becomes a habit for you, it's just a no-brainer and you don't even have to think about it anymore. So, this looks like eating balanced meals. We want to prioritize healthy protein, quality fats, and fiber, and of course, carbs, but we want whole food complex carbs, not skipping meals or under eating, supporting our mineral balance, and managing stress and your nervous system load, and prioritizing sleep. Because honestly, you can have a really, really good diet, but if you are super stressed and your sleep is just shot, that can impact your blood sugar regulation just as much as your diet. And these are just some of my top fertility foundations. And this is exactly the kind of foundations I have every single client lay down inside my Fertile as a Mother one-on-one program because we're not just looking at your hormones in isolation, but we're looking at how everything in your body, your mind, body, spirit are connected. And if this episode is like ringing any bells for you, I highly recommend going back and listening to Tuesday's episode 206, episode 206 with Elizabeth, where we go deeper into this conversation. We talk more about her personal struggle with infertility for 9 years, where doctors were basically telling her everything was fine until we addressed many of these core fertility foundations that finally led to her natural conceptions, and not just one, but two natural conceptions. So make sure that you go back and listen to that episode after this. So let's bring this all together because today you learned you can have a normal, even optimal A1C and fasting glucose, but still be on the path to insulin resistance unknowingly. Elevated insulin, not just your glucose, can disrupt ovulation and hormone balance. And your body is actually giving you early warning signs long before a diagnosis will happen, and probably well long before your doctor would even think to order a fasting insulin lab. And just remember, your labs are not the full story, they're just a picture. Your body knows exactly what it needs. It's constantly in communication with you. We just need to listen to it, and we just need to give it the support and nourishment that it needs to repair and bring itself back into balance. So I do want to just leave this reminder with you at the end of this episode. If you've been told that everything looks normal, but something still feels off to you intuitively, trust that intuitive nudge. And just remember, your body is not failing you. Your body is not broken. Your body is actually wonderfully and incredibly made and is so wise. It's communicating with you. And like I said, when you start supporting it at the root level, things can begin to shift and very quickly. I'll just give you a quick little tidbit on Elizabeth. Like I said, she struggled to conceive for 9 years. We worked together for 3 months and she got her first positive pregnancy test. So these things can shift pretty quickly. So, if you are ready and you are tired of guessing and want to know exactly what's going on with your fertility, why you haven't conceived yet, why you've experienced miscarriages, whether one or more, and you want to know exactly how to increase your fertility now, grab your free fertility strategy call with me and we'll build out your personalized step-by-step plan. No strings attached. The link is in the show notes. And I just want to really thank you so much for listening today. I hope you have a gorgeous day. The sun is out here. I'm just soaking it up. And I will see you on our next episode, released every Tuesday and Thursday. Are you ready to finally discover why you haven't been able to get or stay pregnant? The Ultimate Fertility Blueprint is a quick, insightful quiz designed to reveal your overall capacity to conceive and help you discover potential root causes and areas to address to improve your fertility so you can finally get and stay pregnant. You'll find the link in the show notes. As a quick reminder and disclaimer, this podcast is for educational purposes only and is not a substitute for medical advice. Always consult your doctor or healthcare provider before starting any new supplement or protocol, especially if you're actively trying to conceive or undergoing treatment.